It's good. It's good.
The Truth with Azama-Edwards every Thursday at 6:15 on Goliath Radio. Azama-Edwards, retired city clerk, former city commissioner, city of Daytona Beach. The Truth with
How's your current
Azama-Edwards on
husband?
Goliath Radio.
Well, he's had his health challenges like all of us do.
He's a nice guy. Tell him I said hi.
I will be.
Stan, you've been sitting much too long, much too long. Welcome, welcome, welcome. Welcome, 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 welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is, you got it, power. And as always, I want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, I want you to go to the website at www.gwen-truth.com so you can access all of those all-powerful links to that all-powerful information. And you can also access the YouTube videos of our prior shows, as well as this one, which will be up within a couple of days of tonight's show. If you want to see, if what you hear looks like what you see, okay? We'd love for you to go there, www.gwen-truth.com. As has been stated, I'm Gwen Azama-Edwards, former city commissioner, retired city clerk, city of Daytona Beach, and community volunteer and all of that good stuff. Some call me a political activist. The bottom line is that I'm all about being involved and helping you to stay informed and be involved as well. Tonight is another special show because I have two individuals who are going to talk with us about the Patient Protection Affordable Care Act, affectionately known as, for those who are affectionate toward it, Obamacare. And we're going to try to clear up some of the mistruths, misunderstandings, and the like that people may have in regards to the affordable care which is now available for all of those who do not have health care insurance. All right? Okay, super, super, super. And generally I would do all kinds of great shout outs and share all kinds of information, but this is just so key and so important, and we only have a short amount of time to try to cover a lot of information. And because these two individuals are so knowledgeable, I want to make sure that I say as little as possible and that they are able to share as much as possible. Who are they? Well, these individuals are Linda Merrell, and I just call her a child advocate, and she'll tell you that a coalition she's a part of and everything else, but she is child advocate, hey, bar none. In addition, we have Joyce Case, who is, and Joyce can go more into this, but she's representing the Northeast Health Planning Council. She also is coordinating, to an extent, the navigators who are part of a contract that the Health Planning Council was able to garner through the federal government, through the dollars that were available. And she is going to then share information in terms of what's happening as far as affordable care and the sign up in this state, the state of Florida. So welcome, welcome, welcome to all of our listeners, and welcome, of course, to our two guests, and a shout out to all of those who are working to make the availability of affordable health care in our state, in our community, and around the nation. We just thank you, thank you, thank you. Now, not quite sure who wants to start out. It might be good for Linda to start out, since Linda, you've been pushing this thing pushing this thing in terms of health care, affordable health care, for our young people and for people in general. This is something that that you have just been all over the place sharing getting informed and then helping to inform other people. And it's just awesome, awesome in terms of what you've done. Your family probably would love to have more of you. But this is what you're about. This is what you love. This is it's just something that you cherish and that you're passionate about, and I thank you for that.
Well,
Please share with us, and I need you both to speak into the mic so that it can be picked up, and we can also hear you when it comes time for the video as well.
Well, Gwen, let me first of all tell you, you humble me with those words, and I think that it's actually a definition of a glad fly. I've been flitting and flying, but to where did I come from kind of thing. Let's put this in perspective, because it is a long trajectory of time. I don't think many people realize in this county that many years ago, Congress awarded 3 states a grant to look at and develop programs for the growing number of uninsured children in the country, long before Obamacare, long before whatever we wanted to do. And the 3 states were Maine, Michigan, and Florida. Well, Florida and Volusia County has a very, very important role in that, because we were in Florida awarded this national grant to look at ways of how can we reduce the growing number of uninsured children. So enter in what Healthy Kids became. Healthy Kids was a law passed by actually our very dear friend Sam Bell when he was in the legislature, and he developed this program. And that was the model that we built on. Now, that went for 3 years, and after the 3-year grant from Congress ended, lo and behold, the national law called the Child Health Insurance Program was passed by a bipartisan group, Orrin Hatch and Senator Ted Kennedy.
Called CHIPA.
It was called CHIPA.
Affectionately.
Actually, it was first called SCHIP.
SCHIP, right.
Yeah, and then it went up. Now, the only reason I want to bring that up is that I do think there's a longevity here that we have in our county that we can bring forward as we go through this very complicated, complex time of uncertainty and confusion by so many people. And to tell you the truth, it was just like that when we had our little teeny tiny Healthy Kids grant that had to become a statewide project, and people were saying, oh, we don't need this, and even people in the medical community. So why I wanted to preface that is because there are some good things that have happened. And if we could just look at those for a few minutes, and I actually wrote some of them down so we know some of the things that have happened under the beginning of the Affordable Care Act. They are happening, they're in place, and there's a great deal of information on healthcare.gov that people can go to and find out about. And I'm going to make my comments short for one reason. I think the centerpiece right now of a lot of confusion is the advent of open enrollment on October 1st. And you've been talking the week before. It may not be the amount of chaos as confusion. But I do want to just have a little tiny, if I could, did you want to ask a question?
No, please.
Okay. The reason why we had to do something about the uninsured is we had the escalating cost of premiums. We had hospitals, bad debt going up.
And that was impacting the country and creating more of a deficit.
Absolutely. Listen, somebody did just pull this out of a hat. And by the way, the first similar bill was in 1997 by a very beloved Republican by the name of, just a second, just listen to, oh, good, how did I ever do that? He was 1997, a Republican senator, Bob Dole. I just thought we could. Bob Dole put the same package out there, and it was defeated. So it's been thought about before. How do we reduce premiums? How do we change and escalating growth of care costs are terrible. So anyway, good things have happened. In Florida, why it's important, there's over 3 million people that are uninsured. I think we're rated second in the nation, right, Joyce? We're way up there. So it should mean a lot to people in Florida that we do something about this. So what we have for the CHIP part and the child health, I mean, we brag about what we're doing for children, and yet we're in the second highest percentage of children uninsured in the country, and in Volusia County, in the state, about 500,000 statewide that are uninsured. Half of them would be eligible for our kid care program, but the other half would fall under the new expansion of what would be under the Affordable Care Act. In the exchanges, and that is exactly where those kids will be picked up and be able to. The other thing that they did under the Affordable Care Act is children now, in healthy kids, there's different levels of enrollment at different ages and different incomes. This kind of levels that. They used to call them step stair kids because you could have a family with 4 kids and 3 different programs. This Affordable Care Act, because of what they've done to blend the CHIP program with the exchanges where families can enroll children, they kind of level that playing field. So that is some other really good stuff that is going on. I'd like to go into the fact that women now can get preventive care services. No longer does the insurance company drop people because they have pre-existing conditions. These are just some of the highlights. We have a long list that we could do, but so I think having people go to healthcare.gov is a great resource. Here's one that's been around ever since we had Kid Care, is a single application for the CHIP program and also for Medicaid. We've been asking for that for 15 years, and with the advent of the Affordable Care Act now, they are in Florida under the Agency of Healthcare Administration. Is developing that, and it should be up and going by December 1st. We had hoped in October, but these things take time, and we're talking about a massive shift that's going on, but at least there is some positive things. There have been problems for years and years. The medical loss ratio, and I wanted to just bring that up because there are people that are now getting rebates from their insurance companies because heretofore a lot of the managed care industry was only spending 60 to 70% of the premium of the dollars that were coming in on direct care. Now, with the 80-20 ratio, and that's for the large employer, and for the small employer is like 85%, that they have to cover 85% of what is direct services in healthcare. That's terrific.
And if they don't, they have to then provide
I've got
refunds.
Refunds. Some of the money that came back, for instance, in the month of August, $183 million in 2012 was rebated to people that had been were not getting their full cost of the premium. So, that's common sense. That's good. I don't care what party you're with. Bottom line is where's your money going, and I want to get the best bang for my buck, and especially if it's healthcare. So those are just some of the highlights, and I know that it's really important for Joyce to get going here, and I think that as we both talk, it would be good for me to be able to bring up some of the small business things that are really, really important, and I've got some of that information that I've got to a chart to look at too. But I think right now there's an element of real confusion about what's going on with the navigators and open enrollment. So we could segue, Joyce, into that a little bit with your permission. I think in that way, then we can interject some of the parts that have to do with small business.
And Joyce, if you would share, as I've mentioned, Joyce, the program that she is with, and it's the Northeast Health Planning Council. They received a grant dollars to actually help with the navigators. And if you could share with us just a tidbit about the Health Planning Council, and then get into the navigator part of it, because there's a lot of confusion, especially in some of those states that are doing all that they can to impede the progress of people signing up. What was required for the navigators in certifying them? Why is this the case? And we in part understand that. And kind of where we stand now in terms of the availability and locations where people can go and all of that good stuff that I know you're on top of, Joyce. So if you could share that with us, I would appreciate it.
Okay. The Health Planning Council of Northeast Florida has been addressing the healthcare needs of individuals in Baker, Clay, Duval, Flagler, Nassau, St. John's, in Flagler and Volusia County, for the past, 40 years.
Mhm.
So we have been a long-standing organization, and I think that there's confusion about who is the Health Planning Council, because they didn't really know what we did or where we came from, but we've actually been in the community for more than 40 years. We received a grant. Our grant was from the University of South Florida that applied to be the Navigators resource for the federal government, and they used health planning counselors throughout the state of Florida to implement the program. We're gonna do our 7-county area here in Northeast Florida for the Navigator programs, and we have been hiring, have hired actually 6 of the 8 part-time positions. I'm a full-time navigator, and we have another individual in our Jacksonville office that's also a full-time navigator. So we're gonna have actually 10 navigators, boots on the ground, to assist people in enrolling in the health insurance marketplace. I think what's really important for us to know is what the navigators are doing, and the navigators are there to help people who need assistance. And what I mean by that is you can go up to healthcare.gov, get yourself an account, fill out an application, look at the plans, and pull the trigger. Make your choice right there. You don't need a navigator to do this for you. And I think that that's the problem. People are saying, wow, we don't have enough navigators. 8 or 10 of these navigators in the 7-county area, we don't have enough. We do, because people can do this on their own. We also have certified assistance counselors that are going to be positioned at many of our organizations, not just in Volusia County, but all 7 counties. It's mostly going to be our hospitals. Our FQHCs, which are the federally qualified health centers, also have certified application counselors. These are also individuals that will be able to assist people in enrolling in the marketplace. There's also your licensed insurance and insurance agents and brokers that will be able to help individuals with enrolling in the marketplace. So there's a wide variety of folks that will be able to assist in this endeavor. It's not just going to be navigators, including the individual themselves that can go on to www.healthcare.gov and enroll in a plan that they think works best for their family.
And another thing that people may be exposed to, and that's fraudulent activity on the parts of individuals who will start to then call and say, you know, it's so difficult and we can help you and we just need you to give us your information and then we're going to charge you XYZ. But what the navigators are doing and those other places that are providing help, that is free, right?
Right. To go back, the navigators, the training that are for both the certified application counselors and the navigators. Now remember, your insurance agents and your brokers are licensed by the state, so you have that protection with them. And if you have an insurance agent that you like and you trust and you want to work with them, do that. Go through them. The navigators and the certified application counselors have to go onto CMS, the CMS website, which is the Center for Medicare and Medicaid Services, and there's a web-based training that you have to take. The navigators actually have to take 14 modules. It's a 20-hour course. They have to pass that course, and then in the state of Florida, there's an extra requirement where we have to register with the Division of the Department of Financial Services Division of Insurance. So we have an additional step that is there to protect consumers from fraudulent activities. So if you have individuals that are calling you and soliciting for your information, saying that they're a navigator, that's not what we're going to be doing. That's not how we're doing this program. We are not going door to door. We're not calling people up and soliciting information. We're going to be at the libraries. In fact, we have a number of enrollment activities scheduled at our local libraries here in Volusia County. We have them set up for the Port Orange Library, East Florida Beach, Edgewater. We're working with Orman. And those are, we're going to be using their computer labs to assist people. We're not going to be putting in the data. That's what's the difference between us and, like, when you go to an eligibility worker at the hospital. we're going to be giving the consumer our computers so that they can log on to the website and put their information in all by themselves. We're not going to be handling any of their personal identifying information or their financial information. All of that is going to be input by the consumer. So all we're going to be helping them with is, let's say it's a person that's not savvy on the computer and doesn't know how to even set up an account. We're going to help walk them through that process, doing screenshots at the library, say, okay, you see this screen, here, click here. That's one thing we may be helping them with. They may not know what a copay or deductible or a premium is. We're dealing with folks that may not have ever had insurance before in their life.
That's the
And so
educational.
we're going to be answering some of those questions for them.
Even though they've wanted it, but just couldn't afford it.
Right, and so I think that those are some of the things that we need to get out to folks to let them know that that's really what the navigators are gonna be doing. There's also folks that do not need to worry about enrolling into the marketplace. If they currently are employed and have employer-based insurance, they do not need to go into the marketplace and do anything. If they have Medicare, they do not need to go into the marketplace and purchase insurance. If they're
And this will not change their
No
Medicare.
way.
No.
In fact, they will gain because a lot of stuff that they may have had to pay copay on for preventive services, now they won't have to pay that anymore.
And
I
if they
mean,
like their insurance, they can keep it. These
Right.
are some of the myths that are
Yes,
out there.
yes.
If you're insured, you're fine. We're talking about people that are uninsured and haven't been able to access it. And I think the educational piece that the navigators are doing are great. One of the other things that I think is a fallacy that we need to correct with the navigators, there was a lot of hype when this first started saying, well, these people are not going to be background checked. And all of these things that have been going on prior to this time, that happened anyway. All of these people, isn't this true, Joyce?
Right.
Any of the folks that are reaching out, whether it's the federal public health centers, whether it's the wonderful navigators that are really educating people, this is a great service. That's a lifelong skill they're learning. I mean, we're not learning for the moment.
and they're basically answering questions as they go along. They aren't building a data bank. They're not collecting information. They're not,
Well,
getting all of your good stuff and all of that.
Well, I think that the people that are concerned about stolen identity, that's different. We're talking now that these navigators would somehow not be background checked. They could be felonies. I have heard so many of those rumors at first that, who who these people are that get background checked and are they all right? And sure enough, they have to be certified and they go through rigorous training, like you mentioned, Joyce. So there's a little safety net there.
And we're not putting in the data. That's what I think
Right,
people
right.
need to hear. We are not putting in the data. They are putting in their own data. They're gonna set up an account, they're gonna put in their own passwords, they're gonna put in all their own information. That is not what the navigators, we're gonna be handing them our computers and saying, here you can use, we're gonna use a computer bank like at the library. We're not gonna be handling any of their personally identifying information. The website that they're going to, the hub, it's called the data hub. This website is a secure website, and it will be taking the data and comparing it with the Social Security Administration website, the IRS website, and Homeland Security. And that's how it's going to, that's why you don't need your birth certificate.
Yeah.
That's why you don't need your W-2, you don't need any of this information. You need to know it to be able to put it in there, but you don't need to have that in your hand when you are working with.
And that is one of the questions. What do you need when you are sitting at the computer and you're getting ready to respond and to input information? So you don't need to have any of that. If you don't know your Social Security number, you should have something with that written down.
Right.
Yeah.
Exactly.
If you don't know, some of the other things that are tied to that, then you need to just have that information. But if this is about you.
Right.
So you should know you and what you then put it in, and this person, the navigator, is there to assist you as you have questions
Right.
about what it is. As you're saying, some of the things that you don't, there are people who don't think twice about if they have insurance. Some of the basic lingo that goes along with it. It's like, I'm approaching Medicare age, and I'm having, signing up for some stuff with that. And there are questions I have on that, and I'll be talking to people about that, even though, I have a master's degree, et cetera. But when it comes to some key information that has to do with your health care and healthcare coverage, many times we don't want to make a mistake. We don't want to mess up anything. So as a result, we need to have people that we can ask questions of. And it's great that this is available for individuals so that you have a resource.
Right. And insurance is the great thing about the ACA, and Linda talked a little bit about some of the new things that happened. One of them was that the insurance companies had to provide the benefits in readable, understandable English. So I think that that's going to be really helpful. But someone who has never had insurance before may not know that insurance companies have networks of providers. So one of the things that they may need to have with them or have knowledge of is who their providers are, so that when they're looking at an insurance plan, is that person or that doctor in this network that I want to choose. And there's also a coverage for pharmacy. So it might be important for you to be able to look at the formularies that are posted on the website to determine whether or not the drugs that you're currently taking are on those formularies. So that is where the navigator could be assisting in someone saying, well, I don't know, and the person may not make the decision at that point. They may decide to say, I'm going to go home and I need to get that information, and then actually go onto the website. They know what their information is, and
now they're ready to
enroll themselves.
But getting onto the website is another, we've got all of these things, that are percolating up, not percolating, but sort of boiling over. And I think the fact that we had what I would call pent-up demand, and the fact that when they went online, people were not being able to get through, and we were reading that in the paper, and we're reading that all over the place, and there's all this hype going on. Well, you can look at it this way. I don't think anybody anticipated that we were going to have the volume of calls and people trying to access. So I think, Joyce, along the way we're saying too, we need patience.
Right.
And that people can do this, but that there's going to be some pushback, and it takes time. And to tell you the truth, it was almost similar to that teeny tiny little program called Healthy Kids some 20 years ago, where we kept saying health insurance is coming for children, it's coming for children. And after the 6 months of getting the program up, bingo, they all came and they were all sick because they hadn't had something called pent-up demand.
Right.
And I think on a macro level, what we've seen is, and those things will be worked out in time. Medicare, it's the same thing. We just look at the history books. Social Security, all of these things take time. Glitches, of course. You don't plug a system in the wall, it takes some time. And then there's ways to be flexible and to work through it. So for anybody listening out there, and Joyce is right on with everything she said so eloquently, but I can just hear the voices in the back that aren't on the mic saying, oh yeah, well, we tried to get online, we couldn't get on, we're getting kicked off. And so there's some patience and there's some opportunities here, I think, with what Joyce is doing.
Well,
to
actually,
help those people when you're enrolling them that way.
The website, you can get onto the website,
Yeah.
there's a little bit of challenges with completing an application.
Yes.
But there is wonderful information up on the website, so if you do have questions, you can go up there and look at the questions.
It's the actual enrollment into the program.
It's actually the setting up an account, and that's where the challenge is right now. And so what people need to know is that this website is gonna be open till March 31st for open enrollment to actually apply and receive your health insurance. If you apply today or apply 3 weeks from today, your insurance is going to be effective January 1st.
January 1 is when it starts.
Absolutely.
So the fact that you've signed up this week, you won't be getting insurance until January 1.
That's right. So there is, you have time. This isn't like Black Friday. We're not gonna run out of health insurance. The sale's gonna last. It is a good thing if people want to just wait another week, 2 weeks, and think about the types of coverage that they want to have. And if they enroll and pay their premium by December 15th, their insurance will be effective January the 1st.
Now I think, and one of the things I heard on Channel 13 is the fact that that one reason a lot of people, they believe, are trying to enroll is that they know what's happening in Washington, and they feel that if they don't sign up now, that they're going to do away with the program, and that they won't have a chance to get health care coverage. And people need to understand that, you know, this has already been passed by the Supreme Court and everything else. It is in place. It is in place, and it's there to stay.
Yeah.
A question that some might have, because you can go online and then there's a phone number that you can call. If you call the phone number, do they just provide the information and you still have to go online?
No, the 800 number, you can actually process your application with the 800 number.
Okay, so if someone is having an issue going online, we're not saying go there first, we're saying you have an issue online and you can't process your application, then you can then go ahead and get on the phone and call the 800 number. And do you know that number?
Yeah, it's 800-318-2596. But I do.
3596.
No, 2596.
2596. Okay, 800-318-2596 is 800.
There are challenges with that as well.
And that's because of the volume.
Absolutely. I mean,
Yeah.
whoever would have thought, and that is what's happened,
Right.
is that that's sort of the good news, bad news.
Right.
Yes,
The
yes.
good news is we thought that people were not going to be aware, that there has not been the good public relations to get it out there.
Or as some legislators are saying, people don't want it.
Well, and case in point for the state of Florida, and this is not to be critical, but it is a reality and observation that we've been leading the pushback for this Affordable Care Act since the get-go in the state of Florida with their lawsuit, that we've been struggling to be able to, and that's with all the wonderful advocacy work in different organizations, to be able to educate people when you're just hitting the wall over and over and over again, including a last day of the session when a bill was passed in the Senate Bill 1842. It was like a stealth bomber. Nobody really knew it was out there. And what was it doing? Well, it eliminated the Department of Insurance and the Office of Insurance Commissioner from oversight over the insurance rates that were escalating. So Florida is part of the law that they have to insurance. It has to monitor the rates so they stay within a certain level, and question those insurance companies. By the way, they're playing along in a pretty good game. They have like 102 different policies that are floating around the state right now, 11 major companies. But what they were able to do in this law is say, Department of Insurance in Florida, you are not allowed to monitor the rates and the rate increases. And that is not a consumer-friendly thing to do to your own constituents that elected you in office. And in all due respect, that is something that has to be dealt with in this next session because it has been very confusing. And I'm very pleased that Jeff Atwater, who is our current commissioner, I see he is doing a webinar with the agency that is doing the outreach visits covering kids and families. He has joined, and I think that is just a little positive spin for our readers to understand, and our listeners. There are some incremental good things beginning to happen. But we're way behind, and that's why I think a lot of folks in Florida are going to need some extra assistance through the navigators. And Blue Cross, not Blue Cross Blue Shield, they're now called Blues. If you look, they have marketplaces set up every place. They opened up storefront places before October 1st for people to come in and learn about. So we have a multi-approach, I think, effort in Florida, but the bottom line is for the folks in the street, it's got to be the navigators and the CACs and our hospitals. The hospitals that are, I know they're not certified yet, are they for, but most of them are probably applied.
They had to apply to be an organization that would offer and have certified application counsels, or CACs as we're calling them. And that again is a consumer protection to make sure that somebody's not saying that, oh, I'm a certified application counselor, I'm a navigator, and they're not attached to anything. So, I do know that Halifax
Halifax
is,
Hospital
yeah,
is
that
one.
And Florida.
I believe that their target date is to be ready by October the 15th, so.
So for people who have already called, and there are people who have thousands and thousands of people who have been able to either make the application online or the phone calls, and they've made their selection in terms of the medal, the bronze or the gold or the.
It's the medal plans. And
Yeah.
Bronze is just like in the Olympics, it's your third place. And then you got your silver and your gold,
Wow.
but this has got a platinum plan.
Yes.
So your bronze plan is a 60-40, and then it goes up. In order to qualify for the tax subsidies, you have to pick a silver plan or better, okay? So if you are between 100 and 400% of poverty, you will get tax subsidies for a silver plan or better. And each of the counties are going to have different options available to them in terms of what the plans are.
Do we know what dollar figure that is?
Yeah, I've got them right here for you.
Yeah.
In Florida, the bronze, and by the way, for a single person at 11,500, it goes up to 46,000 for a single. The bronze in Florida is $304 for the premiums versus the U.S., which is $310, and the silver is $257 for Florida and $249 for the U.S. And of course, the gold was the Cadillac, and it is true that the best buy for your buck is going into
You
the
can afford
silver.
it.
Into the silver. But look at this is after the tax credits for a single person, 27 years old, making $25,000. The bronze comes down to $167, which is quite a drop, and then for Florida down to $113. And the silver, starting at $199, goes down to $145. So those are
Per
significant.
month.
Yeah, per month, but that is significant, and one of the things they did to entice the young adults that tend to feel invincible, they're not gonna get sick, but to get them involved, their essential health benefits is very appealing, but they're also allowed to get catastrophic coverage.
30 and under.
Yeah, 30 and under to get catastrophic coverage, and that reminds me of yet another very good thing that's happened in this community particularly. The fact that now, if your child is on your insurance, you can get coverage under your parent to age 26. So you can stay on your parents' plan. You know how after you graduate from high school and went off to college and bingo, your kid is dropped off of your insurance. Now, families can keep their adult child up on to at least age 26.
And they don't have to live at home.
And they don't have to live at home. They can be married.
Right.
They can be married. Well, this community has had a long history and concern with foster children aging out. This year in the Senate, Senator Dieter increased the age from what was 18 being dropped off to now age 21 in the state, being able to be in foster care. But there was a young man that was working in the Senate when they saw that they elevated the age to age 26 for you being on your parents or whatever. Well, by golly, they put an amendment on that says, he said, I was a foster care. I wouldn't be able to get it. So they wrote in the law before it passed that yes, foster children can now be on Medicaid to age 26, just as a child who's in a parent, their biological parent. That was one of those little secret things that slipped in that was to a point of joy. I mean, this is great. Now we have to get that word out in Florida. So working with people like Alan Abramowitz, Guardian ad litem, and our child welfare system, I hopefully we're going to be able to work on getting that word out, because that's an important piece too for enrollment and getting goes on. But I just wanted to mention that.
Yes, and we want to make sure that, because they're saying that there were some people who signed up for the Affordable Care Act, that's the ACA, that were actually Medicare, thought they were applying for Medicare. The truth is that you can't be Medicare eligible or on Medicare and apply for, they would not allow that to go through because you can't do both, right?
You have to give up one. You can. I mean, but you'd have to give up your Medicare. So, yes, you're right. If you're receiving benefits through another government-funded program, like an entitlement program, like Medicare, Medicaid, VA, TRICARE is the other one, though you have to give them up in order to go onto the marketplace. So most of those benefits, those coverages are equal to or better than what is available on the marketplace. So I would not encourage folks to give up. They would have to rescind their eligibility, their Medicare. I would not encourage them to do that because they won't, and they also then won't qualify for the tax credits.
Right.
Yeah, see, so they don't get any benefit to doing that. So those folks that are already on those government-funded plans you don't have to do anything. You don't have to worry about signing up for the Medicare program or for the marketplace.
And let me just take a station identification break here. You're listening to Truth with Gwen Azama-Edwards, and this is WLE, BIG, 1380 AM on your radio dial in Ormond Beach, Florida. And my guest and I are Linda Merrell, child advocate, and Joyce Case, who's with Health Planning Council, Northeast Florida Health Planning Council, who's also working with the navigators for the Affordable Care Act, the Patient Protection Affordable Care Act. I always think it's important to say those first two pieces, patient protection. Affectionately or not, maybe not so referred to as Obamacare. But we're talking about, of course, the affordable care that is now available to a lot of individuals. And I know, Linda, you have, I'm sure Joyce as well, we've been talking for years about the need for affordable care for the working poor. And this is the piece that allows those individuals who, for the most part, they're not poor enough, they're not rich enough, they kind of fall in the middle and many times have kind of slid through the gap in terms of not being able to get health care, and now this is their opportunity. And for our seniors, they've got Medicare. For our more indigent or those who are in need, who are poor, we have Medicaid. We have other types of programs that are out there that are privately funded for a lot of people who can't afford it, who are part of an employer group and the like. But for these individuals who may be working, and a lot of them are working, but they don't earn enough to be able to afford, to pay for health care. And many times these are the people that we say are making that choice between being able to feed my family and pay for health care. Or they're making the choice that, okay, if I need health care, I just go to the emergency room. That is not, even though you will still be able to go to the emergency room, but at a certain point, there's a penalty that is applied if you do not have health care. And there are people who have an issue with that, but I was listening to the president speak the other day, and what he said was, now, does it really make sense if we've got a lot of people who are joining in who have health care, that we taxpayers continue to pay the high cost of health care for them when all they had to do was go ahead and pay the little that they needed to pay so that they could be covered. You've talked about the unsustainability of the high cost of health care that's been going on for some time. It really does not make a lot of sense for someone to not be insured when they could be insured.
Well, it's pay me now or pay me later.
Yeah, pay me now or pay me
Because see,
later.
here's what's going to happen. You can purchase health insurance, and the 10 essential elements have so many. For kids, it includes vision and dental care. It has rehabilitative. It has pharmacy. It has doctor visit, ER visits. It's amazing what's available on these plans. So if you choose not to have it, there's a thing called, what was being referred to as the individual mandate. But they're calling it the individual responsibility requirement. The individual responsibility requirement, I've heard it on other programs where they're saying, oh, it's just $95, what's the deal? It's just $95. No. What it is it's $95 per adult in the house.
Yeah.
Half of that for each child in the house that remain uninsured. Or 1% of your annual salary, whichever is higher. Oh, so, and then it goes up.
Yeah.
That's for 2014. So in 2015, it goes up to $395 per adult in the house, and half of that for each children, or 2% of your annual income. And then it goes up to that in 2016 to $695 per adult in the house, half of that for each child, or 2.5% of your annual income, whichever is higher. So you pay the tax man and get nothing, or buy health insurance.
At those rates that we were talking about.
Yes.
It's
It's totally affordable.
It's a no-brainer.
Yeah, 56% of the folks that would be in that group that you're talking about would be eligible for the subsidized piece to reduce their premiums. That's when we were talking about the premiums and those bronze and the silver thing. That's what we're talking about. So if you put that in the mix, you see that the bigger one is say, hey, I don't want that sticker shock. I'll go ahead and take and get some good health care. And I think a lot of the programs where people were buying health insurance that were getting the bare bones program. This is what she was talking about, is the essential health benefit packages.
That are required to be a part of it.
The benchmark can't be stripped again. So those are safeguards for people that are terrific. And then what does this all do? You bundle it together, it reduces our premiums. We have healthier people, and I'm going back to what the Health Planning Council is about. It's about healthy people and healthy communities. And this is the path for us to get there. We have a healthier society, and we have individuals who are productive, and to me that means they're going to go to work.
Absolutely.
And what's that
And the
do?
employer is going to benefit.
And our economy gets better.
Absolutely.
Well, from a lot of your folks that are also, like you said, people that don't have insurance.
Right.
I mean, how many times have they had to take a day off because they had to go to they got sick and then they got more sick, or their children, they had to take their children to the doctor or to the ER because they couldn't afford to take them to the doctor to prevent the illness from becoming worse. And so they're out-of-pocket cost to them from not being able to go on the job is so much higher than this monthly premium will be. It will save them money in the long run. Prevention saves us so much money in out-of-pocket services. And that's what's under the Affordable Care Act. I didn't realize this last year when I went and got my mammogram. I was like, they didn't have my copay. I was like, this is great. I know.
When I did it, I said, oh, I don't have to pay. Oh, great, this is awesome.
Well, so some of those things for the Affordable Care Act were implemented early, and that included co-pays for prevention services.
Exactly.
Like your colonoscopy, your prevention mammograms. All those co-pays went away, so that $50 gig that you used to get getting the mammogram, was great.
And prevention is a part of this, and mental health services is
free
a
prevention
part of
visit.
that. And there's a piece even as you go further into it for training for more professionals, more healthcare professionals
that's
and the like.
happening.
Yes,
That's
all of
in
that is
progress.
just, and even, people are starting to see that even if they're in a private program, that their costs are going down. What they're paying for their insurance. They are realizing the benefits of this. And I can tell you, because prevention is a part of a piece of that as well, that in some places they're actually letting people go to gyms, and they're covering the cost of it. I know through Florida Healthcare, they're covering the cost of me and anybody else who's a member to go to a gym. For a lot of our young people, a lot of them go to a gym or whatever. Check, that may be a part of something, who knows, because it's prevention.
I just have to, here we are, three women talking about healthcare, and as you were talking, Joyce, it reminded me of the fact that that women's premiums were higher than men's across the board, and that is now gone. That is now history. And why? Because women were treat as if they have pre-existing conditions, and I think that might have been about having babies.
Yes, yes.
And so, but I mean, all of a sudden, there's so many little things that are percolating up that show, first of all, that it's equity and it's good health.
Leveling of the playing field.
Yeah, and to me, that was something that was a major piece, but you know, we've left out a huge piece of the puzzle here in our conversation, and it begs perhaps another show. And that is the Medicaid expansion debate that's going on in the state. When the bill was passed, it was going to be automatic that folks would be covered at 100% of poverty and below. And that is the very poorest of poor. And what has happened, because Florida has chosen not to expand Medicaid, we came very close last year with an alternative model. Senator Joe Negron was promoting it, a strong, good Republican. I'm only going to mention that because it became a nonpartisan issue, but unfortunately the House did not adopt it. And it would have been an alternative with all the benefits that they needed, but allowing them to do a small copay that would make them keep their dignity and also participate in their health, as you were just saying. Because Florida is not, there's only 36 states that have taken this up, that are allowing them to do the Medicaid expansion. We are losing $51 million that could be going to people that are uninsured at 100% and below. We're talking about people at 100% and above.
Right.
But because Florida didn't move forward with that, and we were hoping that there will be another bill filed this year that's similar, because we are walking away, that money goes to another state. Those are,
And it's just us getting back money that we've already sent to the federal level.
And some of our legislators, all of whom I respect greatly, we need to educate them this year that those are our tax dollars. It is not somebody else's money. And not only that, it's the hospitals are all on board, associated industries, and you've got the chambers, the state chamber that's behind this as well, because that's money that will be covering some of their workers. And these are single people, primarily men, that cannot get Medicaid. And I think it's stunning people to think that we have the poorest of poor right now, probably going into a homeless shelter, cannot get health care coverage. Where do they go? A hospital. Hospitals, this is a big issue with the Florida Hospital Association, and certainly our own system here with the hospitals, and they will tell you, and we need to get that done. That was removed, unfortunately. It became not mandatory, but it became a choice for states. And I just wanted to slip that in because that is a population that we are going to be paying for. And, yes.
And, you know, one of the other areas that people harp on has to do with the subsidies. And, you know, I was thinking, and all of us who've had jobs, who hold jobs, we know that there are dollars that are taken out of our paychecks to pay for future health care costs and our Medicare, right? And you don't have a say. You can't say, I don't want that money taken out, because it's something that government does in order to fund your Medicare. But the bottom line is that even with those dollars that come out, they do not fully cover everything that an individual ends up using in terms of health care with Medicare. So in a manner of speaking, when they talk about, oh, we don't want to subsidize this or subsidize that, there is subsidizing going on with health care. You know, when it comes to Medicare, when it comes to some of these other programs that are made available too. The bottom line is that people are paying funds, paying some money to purchase the health care, right?
But, you know, I think that this, we could always do a mini summit. And I'm visualizing organizing something in this community quickly. I know many other parts of the state are doing that, and the Florida Chain, which is an organization I'm with, and some other groups. But, you know, the competitive market for insurance is going to have a tremendous impact on this. When I say there's 102 plans that meet the essential health benefits being in the market right now, by having more people insured, having more choices, the premiums are gonna come down.
Yes,
The cost, what's this
absolutely.
all about? It's about reducing the cost of runaway healthcare
Mhm.
costs. And so. but-
Which in turn reduces, I will
Yeah.
repeat again, the
Yeah.
deficit.
Right, yeah, and so we're getting into the big pond right now, but in the big pond, you get more fish swimming, you get more people covered,
Absolutely.
your rates come down, and I think that's kind of the guiding principle about what this is all about. But because there's so much information, so much misinformation, and so many myths, we need to hang on to some of the good work like that in the boots on the ground,
Mhm.
with the navigators,
navigators.
with people educating and being able to help people. And with Joyce's background in the health field, which is just sterling, people like this can make such a difference. And it will go on. It's work that has to be done. It really does. But premium rates will come down. The insurance companies love it. And seriously, the Blues, way before we got done with this, were the first ones out of the shop. They went in there and setting up storefronts
Mhm.
to let people know that it was coming.
And when we say the insurance companies love it, because I had someone send me something saying, oh yeah, you know, they love it because they're getting over blah, blah, blah. No, the
I
reason
know.
they are for it, and the reason, one reason, good reason, I believe, and hospitals too, is because they will have more people who will be paying into the system.
course.
And Halifax, one of our hospitals, always talks about the number of indigents that they end up having to provide service to.
Your public
And-
hospitals.
Yes, and
Safety
in no
nets.
way is it covered, the full cost of it covered. If these individuals had health care and they went into the hospitals or whatever, they would not have to pick up the cost, pick up the tab, which means taxpayers picking up the tab.
And then because of we have wonderful hospitals in this community and all over the state, and I think for our friends in the hospital, that is true. What has happened to them, which is a double whammy, is an anticipation of some of these things being in place.
Expansion of
There's
Medicaid
an
and stuff.
automatic reduction in the disproportionate share monies that they would get, which is to offset the underinsured and the people that they could usually shift those dollars to be able to take care of those that are uninsured, that have to present themselves to the hospital. The hospitals are bound to have to pay them. And the thing that we have here is the public hospital really, it's incumbent on them that they have to take
They
care of.
can't turn anyone away.
They can't turn it
Right.
away. So in the meantime, here, the hospitals are faced with having to have reduced dollars, right, Joyce? And so that is the cost shifting us with Medicare rates and everything.
Well, their certified application counselors are
Are gonna
going
be there.
to be
Good.
there, and, I think some of the folks that are currently qualifying for their charity dollars will be
Sure.
steered towards purchasing
Right,
the
so
health.
if someone goes into the emergency room and they don't have health care, they're gonna be talking with them and asking them some key questions, and then providing them with information that will allow them to be able to go ahead and benefit.
Right, exactly, so, and ultimately that's a benefit to our community.
Yes.
Because if you get people off of the charity rolls and have their own private insurance, then it's less people that we have to pay for as a taxpayer.
Absolutely.
Except for those folks that are under 100% of poverty, the poorest of the poor, like at $9,000 a year, up to maybe 11,000 for 2 or 3. They're the ones without the Medicaid, expansion, that are gonna still go to the hospital.
Well, the good thing is that we also have some wonderful safety net programs available to people in our community that they can go to. So that's a godsend really, that we have those facilities
Yeah.
still available. They can, the Ryan White program is still available, the volunteers, the Jesus Clinic. We have a number of safety nets that the individuals that do not qualify for the marketplace and are below 100% of poverty and do not qualify for Medicaid, we have those. And then the good thing is that the folks that are using the safety net programs because they can't afford insurance are going to be able to have insurance to go to a private doctor.
Which will reduce the number
we're gonna ease up some of the pressure that's
clinics.
on our safety net programs.
Absolutely.
I mean,
Well, because the thing with the safety net, and this is the old RN to me, it was a really old long time ago,
Uh-huh.
your current, is the fact that, the thing with some of those clinics, and having worked in some of them, is that, that when you have somebody who needs some surgery or needs something done, that's
Something
a
more
referral
serious.
that you might not have. Now, I do understand that we have some very benevolent physicians or good physicians in this community that will oftentimes pick up and do some of these things on their own. But for the most part, when you're working in a clinic for the poor, you don't have that referral process to take care of what you find, but
Right.
you need some help with it. So it'll once begin to merge and kind of blend
Yeah.
out. I think.
And you know, the other fallacy is that people are saying that this Affordable Care Act was set up to insure everybody, and that was never felt to be the case. There will still be some people who don't qualify, who aren't able to get it, but the greater majority of people will.
Right.
And it gets more people on board and makes affordable care available to them. The other part of that, I think, is that as we find out then, as this works its way through, and we find out those who are not then covered, then they can, you know, look to see what they can do to help those individuals as well. Because I think as your organization says, we're talking about building a healthy America. A healthy America is a productive America, it's a more joyful or happy America. It's an America where we're helping those individuals who are in need, whether it be mental issues or physical health issues or whatever those care issues are, that there's a service, there's a program that's available that will help them through it. And hopefully what we will end up seeing is less of those serious and traumatic and awful things that are going on in our country, because people are not availing themselves or able to avail themselves of much needed help. So if you would share, Joyce, those dates that are so key that people need to know, and the where they need to go in order to apply, again, the 800 number and the website number.
Okay. The dates, the important dates, we just had one, October the 1st, the open of the health insurance marketplace.
And thousands of people.
Gazillions of people
Yes.
have gone to that, I'm telling you, so, and the website
The
is
floodgates.
the www.healthcare.gov, and if you enroll and pick a plan by December 15th, you will have coverage another date by January the 1st. The last date to potentially enroll in a healthcare plan is March 31st, and if you don't enroll by March 31st, the health insurance marketplace enrollment closes, but reopens again next October. So it's really important that if you want health insurance, you go to www.healthcare.gov. It's a little slow right now. You can get great information, maybe not be able to easily apply it just yet. Give it another week or so, and just inform yourself about what's available. The 800 number is 1-800-318-2596. That's the health insurance marketplace toll-free number that you can call. They also have the website available in Spanish, and then they also have available over 150 languages on them, so you need to ask them on a toll-free number. So, you know, this is really a landmark situation that has happened here. And I think one of the things that we glazed over just a little bit was the mental health and substance abuse treatment.
Yes.
I have to tell you that the lifetime maximums are gone. And the devastation of mental illness in this country are largely in part by our deep institutionalizing of facilities back in the early 80s.
Right.
And the lifetime maxes that we imposed on people that had mental illness, they never had parity with blood and bones types of services, and now we got it. And the great thing is that most mental illnesses are treatable. And people can get the care that they've never been able to receive and become productive tax-paying citizens.
Right,
Wouldn't that be great?
we could really use another whole hour, and
Yes.
it begs, well, I think we need to compartmentalize, like even getting into the small business piece thing, I skipped over that, because
Yes.
that's a whole show.
There's subsidy,
But there's some
right.
really important things, and a lot of small businesses are signing up. I mean, we've got the data that shows that, yeah, there's people that,
There's
they
even
know.
tax incentives for nonprofits
There
on
is,
the shop.
absolutely.
Oh,
Yes.
wow.
Yes.
That's a whole nother program. The
Uh-huh.
shop, you can get.
It's called, it stands for the
It's not so
Small
much
Business Health
health, right.
Options Program. And it's for, employers. And it
It's
has been
wonderful.
delayed somewhat to November 1st.
Right.
But people can get information about the shop on the www.healthcare.gov, and there's a part for
Yeah.
employers, there's a button for employers.
Mhm.
And even if the application process isn't open yet, you can, get great information about what you need to do, and what the
Mhm.
tax incentives are for you as an employer.
Right.
This-
I saw
yeah.
something today where Disney is actually.
Absolutely, Walmart and Disney.
Walmart and Disney.
Yeah.
I'm glad to see that Walmart's getting on
Yeah,
board.
I was
They're
shocked.
actually taking their part-time, making them full-time, so that,
Yeah.
that's awesome.
I mean,
That
there's
is
a lot
awesome.
of, I saw that today too, and there's really some good stuff
Mm-hmm.
happening, that's why I think the floodgates open.
Yeah.
I
And
think it's gonna wash away some of the fear.
Oh, absolutely. And the fear mongering and all that kind of stuff was there, the hate mongering, all that stuff, that it was to prevent people from going ahead and signing up, because as someone said, once they sign up, hey, they understand now that it's a great program, and it is going to meet some unmet needs that they have in terms of health care. Once they get a taste of it, they'll understand, and the word will get around. You know, all that stuff you heard, that's not true. It really is a good thing. It's a good thing for individuals, for families, and for the United States of America.
And it's not free. I think that's the important message, it's not free.
It's not universal.
Individuals
totally.
have to pay for this coverage,
Mhm.
it's not free.
Yes, the
Yeah.
thing is that they
Except for-
now can pay, it is now affordable.
Right.
Affordable. They can now afford to purchase that health
Yeah.
coverage.
Right.
And there will be bumps in the road.
Oh, for
There's
any new
nothing.
legislation, especially of this magnitude and that's so close to us.
So that's why the administration has already been flexible and adapted, like when the large corporations they really were having problems. And of course, we've had some pushback with the small employers as well, until they work out some things, but yet you can go on and get into the marketplace.
But what you can't, you have to draw a line, you can't remove the subsidies, because then you're impinging upon
Absolutely.
individuals really actually being able to afford and being, willing to even just sign up in the line.
Well-
There are just some things, and continual delays for what? So that you can again try to kill it? I
Well,
mean.
No, I think with a large, we're primarily, the nation is a small business nation in the
Oh,
country.
yes, the
96%
majority of
of it.
businesses are.
Florida, it's 80-something%, I've got some down here, but nonetheless, it's the large business, there was some complexity, and they realized they couldn't do that, and so there would be that, but yet the framework and the basic core is there and alive, and some stuff's been going on for a year. Right.
And so small businesses, even though there's a piece that has been delayed, they're still going in and signing up and having their people sign up and check it out too. That's what's so key and important, that people check it out.
Right, and even if you don't qualify for the subsidies, the insurance is meant to be affordable.
Yes.
So you can go up there
That's what that's very
and
smart.
look at the plans, and if you're above 400% of poverty, you just won't qualify for the tax subsidies, but you may find a plan up there that's equal to or better than what you currently have at a reduced rate.
Yes,
And
and
what's wrong with that?
yes, and we're seeing what, 300 or less.
Well, right, that's what those numbers, and I'll get
And
that
I
to
tell
you.
you, I
because-
pay between $500 and $600 myself, and that's in group
Yeah.
insurance. And there are people I've heard about, especially those who have those illnesses that insurance usually has not wanted to cover. They've been paying thousands of dollars a month. I mean, we're talking about people whose income has kept them from being able to infuse money into the market, into the economy, because it's all going to healthcare.
Now, those numbers I gave you were Florida specific, because each state is going to vary, and ours are a little bit still high compared to other states. I think Arizona, we're right behind Arizona.
And that's
But
in the
then
300
Yeah, but that
range.
was the $304 for Florida. But remember, I told you that about 56% of those would be eligible for
Well, subsidy, so they go down,
income level.
costs will go down, right.
In the meantime, the big engine of the insurance industry is going to help produce this more and more, because we have 102 plans already viable.
Competition.
The competition, and
Private company competition.
so that kind of fits into what everybody wants in the economy, is to be able to have it be both public and private.
Imagine all of those dollars that have been going to high-cost healthcare now being available to flood into the economy and help businesses and help individuals who now more people can be hired. You know, think of how great this is going to be for America, as opposed to something that I read where that someone said this is the worst legislation that's ever come through the pike. I'm sure they say that about Social Security and Medicare and all the other stuff too, but in actuality, this is something. Affordable Care, the Affordable Care Act, that legislation, the Patient Protection Affordable Care Act, is actually going to help the economy, reduce the deficit, infuse more dollars, make more dollars available that would have been going to health care, and people are going to buy insurance that is now affordable. And it doesn't get much simpler than that.
You know, I would like to recommend that if folks have know an insurance agent, know a broker, use, I'm from Texas. So, one of the things that we were learned in Texas was you bought your city first, you bought Texas second, you bought USA third, and then everything else you didn't buy. But what we want to do is help our insurance brokers as well. They have the ability to help you with a plan that's on the marketplace. Use your local insurance agents to purchase the plans. That puts food, they'll get a commission, but that puts food on their table, and that keeps that money in our community. You see? It's a great thing for us to do. So the navigators can help people, but if you have an insurance agent that's, in your church, or you play racquetball, what do people play racquetball still?
Yeah.
But anyway,
I miss that. It was fun.
That's so 80s. Anyway.
When I was so much younger.
Right. If you have somebody that you know and you trust, use them. Use them to help them out, and purchase your insurance through them, and you don't have to have a navigator. Only if you absolutely need the assistance do you have to have a navigator.
That's your friendly, and that's a perfect piece. As you were talking, there was a piece I got yesterday in the mail, 15 myths about the media that we should ignore, and one of them I think is really great here, and it goes to some of our earlier comments. The Affordable Care Act is not socialized medicine or government takeover. And what we're talking about here is really the privatization in many ways, using an employer-based program. We're using, so it is going to be something that's going to be public and private, and I think it's really, we need to get rid of some of these myths. It's just, it's what's disturbing people greatly, and with the navigators, I would want to read all the wonderful stuff we said. I'm not going to read what some of the myths are, but they're out there. We need to dispel those and get back to the show is a truth show.
Yes, and if you want to know more information, you can go to the library and get on a computer. www.healthcare.gov has information. You can look at the information, you can read it. It does have information that dispels a lot of the myths that are out there, a lot of the untruths that are out there, and you can do that at your own leisure. The bottom line is that this is a good thing for you, it's a good thing for your family, it's a good thing for your community. And if you already have health care, you can check it out, but again, we have Medicare that's in place for our seniors. This will not change that, it will just improve it, what's available. We have health care for a lot of our poor individuals who are on Medicaid. and the like. And since the state didn't expand it, that left some people out, but we've got those kind of covered in many ways, but it's a lot of our working poor. And these are people who are working who just cannot afford it. But you know, when they go to the emergency room, when they go and they get health care and they're not able to afford it or whatever else, we are the ones, everyone else are the ones who pick that up. This is something that will help the deficit, it will help the economy, it will help infuse more dollars that we're going to healthcare back into the economy, and it is a win-win for everybody. No matter how much people want to fight it, it's a win-win for everyone. Again, go to healthcare.gov, call the 800 number, 1-800-318-2596. Please, 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 even if you have some and you have relatives who don't, have them to check it out, or you check it out for them and refer them. Closing comments, guys. This is just, I know we've just tipped the, you know, it's just the tip of the iceberg that we've covered, but it's just so key and so important that that in this information get out to the public. So closing 30-second comments.
Well, I guess with the children, I'll go first, and that is what came to my mind as you were talking is, you know, Rome wasn't built in a day, and system reform takes time, and do we need it? Absolutely. When we have 3.5 million people in the state of Florida that can't afford health insurance, going to the ER, it makes sense.
Absolutely, absolutely.
Makes good sense.
And Joyce, for the navigators.
The navigators will, I want to also include in the navigators that the Epilepsy Foundation got navigator money,
Yeah.
and so
Oh,
did
wonderful.
Mental Health America, so the Mental Health Association also has navigators. So
Wonderful.
if you need a navigator, then use a navigator. We will have them available in the communities. We're going to have some enrollment fairs. We're partnering with Walgreens and the libraries, and we will be announcing those throughout the community. There's also the CACs, the Certified Application Counselors, that will be available at Halifax Hospital and the Federal Qualified Health Centers out in D-Land. So we're going to be there to help people. If you can do it on your own, go for it. If you can use an insurance agent, use your insurance agent. But look at the marketplace and get enrolled.
Absolutely. And for those who are of Hispanic origin or nationality, that there will be programs that will be out there to provide you with assistance as well through navigators.
In Espanol.
Yes,
In Espanol.
and outreach services for you as well. So you will not be overlooked. Don't allow yourself to be overlooked. Check it out, the Patient Protection Affordable Care Act. It is there for you, and it helps you, helps your community, helps your family, helps the United States of America. It's good for us. So thank you guys, thank you to our guests again, Joyce Case with the Northeast Florida Health Planning Council, who is coordinating the navigators for the Affordable Care Act, and Linda Merrell, our child advocate. And thank you guys for listening to Truth with Gwen Azama-Edwards. Again, go to the website www.gwen-truth.com. I will have this video up for you to see as well and to hear more. And again, go to the website www.healthcare.gov so you can get more information on the Affordable Care Act. And be sure to go to our website www.gwen-truth.com. Until next time, be informed, be empowered, stand tall for that which is right and truthful. Again, this is Truth with Gwen Azama-Edwards, and like you, like our guest, Joyce Case and Linda Merrell, we're all standing. You be blessed and have a great week.
Gwen Azama-Edwards, exclusively every Thursday night on WELE.